For the most technically challenged individual here, I got a computer.
Some of you will recognize these names. I came to Chestertown about 40 years ago. When I came to Chestertown, there were no board certified cardiologists, no internists at all. There was no residency trained practitioners. We had one board certified general surgeon. That was 40 years ago, 1974, which I guess it's 41 years. But since that time, in 2008, the next 34 years, because we had excellent administrators and a hospital board which was local, we made great strides in improving the quality of care you could expect at our hospital. In 2008, some of these things I know you've heard before, but I didn't know what others were saying. But anyway, in 2008, the Health Service Cost Review Commission certified us for 62 beds. We had a vibrant medical staff. We were all now board certified but one person. Our ancillary staff and allied health professionals were all part of this community. You, citizens of Kent and Northern Queen Anne County, love this place. When we had an event such as a Christmas shop or our golf tournament in the spring, the turnout was marvelous. Now what's happened since 2008? Well, since 2008, HSCRC says we don't deserve more than 31 beds. Part of that is because I understand, of course, that a lot more services are provided in same-day surgery and that kind of thing. But nevertheless, however you want to try to rationalize it, we have been diminished dramatically. Our morale couldn't be worse. Medical staff finds the current administration most doctor unhealthy. We have had loss of services, as noted here. We all know about obstetrics and pediatrics happened in a couple of years after Shore Health Systems took us over. The week before they closed us, they told us they had no plans of doing so. And that's what we're worried about now today. We had a pathologist here. He realized that the writing was on the wall. He moved away. And what did we get in return from Shore Health Systems? We got a pathologist 2 days a week for 2 hours. Totally unacceptable to a active surgical service. We no longer have operative urology, which we had back in 2008. We have no ophthalmology in this hospital any longer. Our ENT surgeon that we had retired, and he was not replaced, in spite of multiple requests, at least by myself, as I know the rest of the medical staff also. Then some years ago, we had full-time nephrologists here, kidney doctors, and because of that, our foundation went out and raised the money for have inpatient dialysis. However, those 2 dialysis machines are now in a closet somewhere because our nephrology service has diminished, so we no longer have that. We also have a markedly reduced orthopedic surgery service compared to what we had 8 years ago. Again, the feeling is that a lot of this is due to administration has not been particularly friendly to our physicians. And as I said, the beds have been reduced accordingly because we've lost services. Of course we're going to lose services when of course we're going to lose beds when we lose services. That's a no-brainer. What do we need to do as a community? This was in your newspaper, December 5th or 7th there, where the doctors on our staff wrote down what we thought we had to have Shore Health Systems do if we were going to continue to be a vibrant hospital. We want to continue with inpatient services for all our patients. We want to maintain our CCU. There was some talk about closing our CCU. We're insisting that the CCU not be closed and rather be upgraded by providing intensivists. We want to continue, of course, our general surgery, both inpatient and outpatient. We want to do our surgical subspecialties, whether it be orthopedics, gynecology, or plastic surgery. Maintain our oncology and chemotherapy, cardiovascular and pulmonary diagnosis and rehab. We want to restore our inpatient dialysis and have a top-rate X-ray department. But most importantly, or at least as importantly, is we want marketing and promotion done of our hospital. We're tired of seeing in our local newspaper what is going on in Easton. We want to see in our paper. Most of us don't appreciate getting requests from the Foundation Easton asking for money for Easton Hospital when we have needs of our own. The key to this hospital being successful and being vibrant is administration interested in improving the quality of care you can receive at this hospital. We need an administrator whose primary objective is the health care of northern Queen Anne and Kent County. We would like to have that administrator live in this community and know our community. But we at least want him to be available so he can address our concerns, the medical staff, the nursing staff, and our citizens. We could do better with an administrator who also sort of his job to recruit physicians to this community and not have them all go through the search committee in Easton.
Yes.
It's been a constant request of Easton now for some years. They refuse to address our concerns about our getting new primary care for further specialists. As Eileen Brooks said in the paper, we're being set up for failure. I don't think it's too much respect for your imagination if you let your imagination go just a minute. As our doctors here retire and move on, without an inpatient hospital, young doctors who are in demand are not going to come to a community where there is no inpatient hospital. Therefore, your young, skilled, qualified young physicians are going to find someplace else to go, and it won't be Chestertown. And what I fear is that years in the future, maybe not next year, maybe not 2 years from now, but as the years go by, we will have a great deal of trouble finding even the most basic health care here in Chestertown. Here will be a Helena or a Senator. And this is not what we want. We need a hospital. We need a hospital with inpatient beds. We're not asking for a medical center with neurosurgery or cardiovascular surgery to be performed. We are asking for a place where we can receive uncomplicated medical and surgical care. There is no reason why this community should expect their loved ones to recover from an illness in a facility which is an hour away. This is what I call quality medical care. We need UMMS and Shore Health Systems to honor their promise. About 8 years ago, a vast majority of this community recognized the merger with University of Maryland for what we thought it was going to be. Our hospital would not exist. But however, we were promised at multiple community meetings, I think many of you probably went to, that they were going to maintain services, they were going to increase the number of specialists we had, and they were going to increase accessibility to quality health care. They have done absolutely the opposite. Take any one of those up there, and they have not done it. They have not maintained services, they've not increased the number of specialists, and they certainly are talking now about accessibility of seeing our loved ones in the hospital, us needing to go to some other facility that's at least 45 miles away. We realize we are small, and this is my conclusion. We realize we are small, but we also know that we're not losing money for the system. Therefore, we feel it's not unreasonable that we should expect to continue to have inpatient beds and increased services we provide to our community. And the point of my first 2 slides was I want you to know that with hard work, as our administrators did back then, and our board did back then, we developed a real fine, top-notch hospital, and I believe we can do it again if we all pitch in and make our demands known.